In the next video I will show you the ligaments at the coracoid process and also assessing the supraspinatus. So when we scanned the subscapularis, we ended near the coracoid process to search for impingement. So this is also the starting point to scan the coracohumeral ligament. The coracohumeral ligament connects the coracoid process with the greater tubercle. So when looking at the subscapularis, we're also looking at the coracohumeral ligament, which can be seen right here. Underneath the gliding subscapularis and attaching with a broad expansion to the coracoid process. So look at this ligament for thickening and also stiffening. After having a look at the coracohumeral ligament, we're going to search for the coracoacromial ligament. So connect the coracoid, the transducer with the coracoid process, but also with the acromion right here. And now I'm going to show a lateral rotation, external rotation, and what we can see underneath the coracoacromial ligament is movement of the supraspinatus muscle and tendon and also the subacromial bursa. To check for impingement, you could also use other movements, for example abduction, adduction, or even if you would assess overhead athletes, you could also look in this position, a sort of a pitching movement. What we want to check at this ligament is that the ligament stays flat during the movement. This is good, and that there is no convexity or bulging up, which would mean that there is a pressure underneath. Then I'm going to turn the model a little bit and placing the arm in a modified cross position, and we're going to check the supraspinatus in transverse, and we're going to follow the fibers of the supraspinatus until their insertion to the greater tubercle and also back. Look at the tendon quality, tendon thickness, but also if you see any fluids in the subacromial subdeltoid bursa. After having checked it in transverse, we're going to rotate the transducer to longitudinal plane. And again, we're going to sweep the transducer, slide the transducer over the longitudinal supraspinatus, back and forth, so that we have a good overview over the whole tendon and overlying bursa. If you want to see the bursa laterally to the greater tubercle, so that is a wise thing, as sometimes also bursal fluids can be accumulated right there, even if the bursa on top of the supraspinatus looks healthy. So always also check laterally to the greater tubercle. Let's place the patients with the arm next to the trunk and in this position. And now what we're going to look at is the supraspinatus. The supraspinatus gliding next to the acromion during a abduction. So abduction and back to adduction. Yes, and to see whether there are signs of an impingement of this posterior supraspinatus tendon and the subacromial bursa in relation to the acromion. So you're looking for buckling of the tendon or effusion in the bursa, and this all looks healthy in this patient. So if we're going to slide the transducer more towards ventral, then at one point you will lose the acromion right here. And you will see a hyperechoic transverse coracoacromial ligament on top of the supraspinatus. And now I'm going to move again to abduction and adduction, and you will see that the bursa and the tendon is moving underneath the hyperechoic transverse ligament. This is a very good spot to look at. I see more impingement signs at this level than I will do at the acromial level. So this is definitely something which I do always in my protocol. And last technique I want to show you is the supraspinatus muscle. So if you have a large cuff tear, you will expect also a fatty infiltration. So if you want to check for fatty infiltration, you can place the transducer in transverse plane over the supraspinatus muscle. All right. Like this. And now we can see the supraspinatus muscle in between the spine of the scapula and the clavicula. and we can see the hypercoic supraspinatus aponeurosis. And looking at the muscle, I will compare the muscle with the overlaying trapezius muscle. So the acugenicity of both muscles should fairly be the same. Last test is a strength test, so I'm going to place a pressure against the patient's arm, asking for an abduction, and then looking at how the muscle fibers behave during this contraction.